Good afternoon. Welcome back to Cool Your Heels with Lillian-Cauldwell on AMFM247.com and Passionate World Radio Network, the world in your hands. And today our special guest is Dr. Jane-Orient, who is with the AAPS. So good morning, Jane. How are you today?
Doing fine.
Great. Could you explain to everybody what the AAPS is and how important it is and what's happening politically?
This is the Association of American Physicians and Surgeons, aapsonline.org. We were founded in 1943, that's 75 years ago, to preserve and promote private medicine, which is where the physician is working directly for the patient, not for the government and not for third parties. It's really important for patients to have an independent physician who has his best interests in mind, instead of somebody whose paycheck depends often on denying care.
So in other words, if a patient comes in to see one of these doctors, they'll get taken care of and they won't be put on a waiting list.
Well, I can't guarantee that everybody can get in to see the doctor immediately, but the idea is that the doctor will be doing what he thinks is best for the patient instead of following the dictates of managed care guidelines, which are often very, very restrictive.
So these doctors then are independent of working with hospitals that belong to large organizations that dictate to the doctor and to the hospital how much time a patient can spend with the doctor, what kind of medications can be dispensed to a patient. Yes,
more and more managed care organizations, which are calling themselves insurance, are really very much in charge of care, and so it's important to see a physician who does not have his livelihood dependent on them.
So, how important is this type of practice, medical care for a patient, as compared to something that's to a managed care and the and the rules that go along with it?
Well, I think it's important that you have a doctor you can trust, and you really can't trust a doctor who has a conflict of interest. A doctor who cares about you, and it's good to have a doctor that gets to know you. And managed care organizations often shuffle people around, or they change your plan, or they assign you to whoever's available, or often to someone who's not a physician at all, but is a nurse or PA that has a tiny fraction of the training that a physician has.
Now, are you your organization trying to get involved with what's going on with the different candidates for what's going on with, for example, Trump getting rid of preconditions being covered by insurance and by the amount of, say, tests that a patient can have done and certain type of medications being pushed onto the patient, whether or not it's good for the patient?
Well, we're very much involved on the political scene. One thing is with these prescription benefit managers, PBMs, that may be taking a big kickback that may be largely responsible for the scarcity of drugs and for the very high prices. And as for the insurance, we are very much in favor of allowing freedom for patients to choose their own insurance plan. And the pre-existings, I think, is a big political thing. In fact, you cannot buy insurance for pre-existing conditions. You can't buy car insurance if you have a lot of DUIs, at least not for the same price that other people. You can't buy fire insurance while your house is on fire. And what with health insurance, really, you should buy an insurance policy when you're young and healthy and pay for it every year, and then they can't cancel your policy by contract when you get sick. But what has happened with everybody getting insurance through their job, if they lose their job, then they are on their own, and if they have to buy individual insurance, they're going to be underwritten, which means that if they have a pre-existing condition, then either their premium will go up or the insurer will deny coverage at least for that condition. I mean, that's sort of a fact of life, and people who have pre-existing conditions have a problem, and we definitely should help them, and there are lots of ways of helping people without wrecking the whole concept of insurance for everybody so that nobody can have a plan that they can afford.
Well, I had a pre-existing condition, and I can tell you straight out that before I got on Medicare, that I was paying well over $1,000 a month to get the insurance, and it was minimum care insurance. They really did not want to have to pay you for anything if they could possibly avoid it.
That is kind of how insurance works. It's a gambling thing. They're gambling that you won't file a claim, and you're gambling that you will. And so there are a lot of moral hazards in this both ways. And there are many, many problems with our insurance market, but I think what the politicians are trying to do is to turn it all into socialized medicine, where everybody has to pay for everybody else's medical care, but nobody can pay for their own. And the prices are driven up outrageously high because everything's covered by third parties, and there's no honest price signals, and there is no incentive for these providers to keep their prices reasonable.
Especially when it comes to pharmaceuticals. Why is it that some of the really precious type of drugs that people need for their kids to live, the prices go over the hill? Is it because of greed? Is it because there's a lack of the supply that they can get them from? Or is it the preparation itself of the drug that puts it up there?
Well, I think that you may have all of those things involved, but the game Monopoly that everybody knows, that exists in the drug market, and partly because of regulation, that competition is not allowed, and not just competition for the first few years in order to allow the drug company to recover its research costs, which, by the way, are inflated to probably 100 times what they ought to be by the FDA, and then there are restrictions on how much drug the company can manufacture, and so on. So, there is a real all kinds of pressure to up the price, and there's very little pressure to lower the price because there's no competition, and because there are no honest price signals, and because most of the time a third party is paying for it, not the patient. And the insurance company just ups its premiums up and up and up, and people don't really understand why.
Now, I know that when I got my flu shot this year, for example, I had it through the doctor, but he was telling me that because so many places are now offering free flu shots or below the market price, that it's very difficult for doctors' offices to actually get the flu medication into their office to offer to their patients. Is this true?
I expect that's doctor's experience. I think, of course, there are no free flu shots. I think that the pharmacy may give you that to get you in to sell you their other products. I mean, they're making a profit from it some way. Maybe not from the shot itself, but from having the traffic through the store. And the doctor, of course, does not have that means of offsetting his costs.
So the doctor then is behind a rock and a hard place.
Yeah, that's right. I mean, you can't really expect him to pay to work. You can't really expect him to buy the flu shot for you, and yet that may be what he would be doing, because his costs are just high and fixed, and there's no way of using it as a loss leader.
Do you feel your organization feels that the managed care is really trying to put regular physicians who refuse to join up with them out of business?
Oh yeah, and I think it's happening all the time. A lot of them have their network, and physicians either refer in network or they get kicked out. So you have a problem, and I think this particular orthopedic surgeon is the best at handling your problem, and he has good results and fewer complications. If he's not in network, if I were in the managed care network, I would be risking my job to say, go see this doctor instead of another doctor whom I may not know or who may not have such a good reputation.
Has the free doctors who are not part of the managed care, have they thought about maybe banding together and forming their own type of association to protect themselves from what's going on with the managed care?
I think a lot of them are afraid to do that because they think that they will be in violation of the antitrust law. So things that it was perfectly okay for managed care organizations to do would be illegal if independent doctors tried to do it. So the government is suppressing this type of activity.
Couldn't they sign up with a union along those lines, where they're union members as the medical practice?
Well, I think to be a union, to join the union, you really have to be an employee, and doctors and independent practice. And plus, do you really want your doctor to belong to a union and be beholden to a union boss and be going on strike?
No, you don't. But I know that it's getting harder and more difficult to find a doctor who really is dedicated to helping the patient and be concerned about what is wrong with them rather than go into a managed care setting, which I've also tried, and you're in there for about 5 minutes or 10 minutes, and somebody comes in practically with a little alarm system saying, you're 10 minutes up, you got to go on to the next patient. To me, that's not managed care. That's an indignity.
Wow. They've got a timekeeper riding her on the dock?
Yes, they have them at the major places like Kelsey-Seybold, and there are a couple of others. St. Luke's is huge. It's all over the world. And they pretty much have a gatekeeper who comes in saying, yep, your 10 minutes are up, please. Or I understand that one of my doctors used to complain to me that he would be called in and, yelled at because he did not stick to the schedule that they put up with how many minutes you would see a patient. And he says you can't find out what's wrong with that person in 10 minutes. There's just no way, and examine them at the same time. So
no way to practice good medicine.
No. He was very, very unhappy.
Patients are, this is really awful, but, patients have come to me when managed care first gained a stronghold in Tucson. I can't come to see you anymore because you're not on my plan. And I would say, well, you're welcome to come see me. I would be very happy to see you. And they would say, but I have to pay $35.
Yes. Yes, the price would go up if you got a doctor at a plan.
Yes, and the patient has already paid, or his employer has already paid a huge amount for him to belong to the managed care organization every month, month after month, regardless of whether he gets any care or not. So I think it's very bad, and that there are more and more doctors who are seeing the light and are going private, and we do have a database on our website, aapsonline.org. Under the patient tab, there is a list of practices by state who say that they're friendly to cash-paying patients who seeing them out of a plan. In fact, the doctor I just went to see yesterday said a lot of her patients are insured, but they come to see her anyway because they can't get in to see their insurance doctor, and they pay her $50 for a 15-minute visit and $100 for a half-an-hour visit. But they can get in very quickly, and they have her undivided attention.
And it makes a difference.
Absolutely it does. You cannot practice good medicine in 10 minutes.
Why do you think that they still continue with the managed care? I know it used to be, because this is a business, and we need to keep our beds full. But I also know that most hospitals empty out their hospital beds on Friday night because they don't want the care of the patients during the weekend.
Well, a lot of these big hospitals, especially the really huge ones, the merged ones that have merged and consolidated all over the place, they are really focused on the bottom line and on getting lots of money in. They don't want to have an extra nurse on the floor, no matter how badly she's needed. It really is it's a very precarious situation for hospitalized patients.
Has anybody done an expose on something like this to try and prove that for all this money you're pouring in, that the lack of, resources, that's what they keep screaming, they don't have enough doctors, they don't have enough nurses, they don't have enough orderlies, and yet by the time you're nickeled and dimed out of the hospital with your prescriptions and with the doctor and with all the different specialists coming in and the different tests that they do manage to fit you in those first 24 hours, you would think that they would have enough revenue coming in that they could be a little more user-friendly to the patient?
Yeah, you would think so, but the hospitals have a huge amount of clout in the legislatures, and I think that a lot of the news media is afraid to do exposés, so a lot of this information does not come out.
Wow.
Doctors are afraid to talk because they could be kicked off the staff for some trumped up reason and then be unable to practice anywhere. Patients
So they
not,
can do that. I did
the
not realize that.
Hospitals can do that. There's a process that we call sham peer review. It's supposed to be peer review to get rid of doctors who treat patients badly or are incompetent. But in fact, it is often used to get rid of the doctors who complain about the hospital's quality problems, who may be the best there is, and maybe their colleagues don't like the competition, or who insist on patients getting better care and who just don't go along with what the hospital wants. The hospital can trump up charges and put them through a kangaroo court type of procedure and kick them off the staff, and then they go into the National Practitioner Data Bank. The doctor can't get privileges at other hospitals. He may even have problems with his medical license. So it really there is a very powerful blacklist out there for what they call disruptive doctors.
Wow. I didn't know any of this existed, and I suspect that most of the people out there who are trying to get decent medical care are not aware of that.
I think that they're not, and they have confidence in their hospitals, and they believe that where there's smoke, there's fire, and that the hospital would never have blacklisted a really good doctor. But that is happening all over, and it is really a scandal.
I'll say. So, Dr. Orient, can you please tell everybody where they can find the AAPS and you, how to get information that they will need to get themselves a good doctor, and anything else that you feel that the patient needs to know?
They can go to our website, aapsonline.org. You can sign up for our free email alerts. All of our newsletters and journal articles are available free of charge. We send out periodic action alerts on important issues. We have a list. We have a patients tab that has access to a list of physicians in various states that might be able to help you. If you find a good doctor, please encourage them to list themselves on our website, and you can communicate with us through our website.
Terrific. Well, ladies and gentlemen, and patients of all ages, you've heard it from Dr. Jane-Orient from the AAPS.org about some of the problems that they're facing in today's medical world, and something that you ought to think about. This interview will be heard on youtube.com/Passionate World Radio Network, facebook.com/PWRN LLC, and Passionate World Radio. It will be heard on Google Plus /PWRN LLC, on AMFM247.com on Tuesday evenings from 8 to 9 p.m. and also on https://PassionateWorldRadioNetwork.com. And before you go away and stray, Joe Burr had this to say in 1842, "Those who never retract their opinions love themselves more than they love the truth." Thank you all very much for listening, and remember, please keep listening. Thank you.